Welcome back to my channel. I'm Dr. Jin, and today we're going to be talking about Botox or neuromodulators. There are three main neuromodulators or variants of Botox that I like to use in my practice. One is Botox, the other is Dysport, and the third is Xeomin. And there's a lot of just kind of myths about which one to use, which is better, which lasts longer. In actuality, they're all very similar to each other. There are little variations between the three, but in the end, they're all designed to do the same thing. They're designed to help smoothen fine lines and wrinkles. How? By paralyzing the muscle that it's placed at, right? Whether they're your frown lines, your levens, your crow's feet, treating the RBF that a lot of both men and women, let's be honest, both have. So what's confusing to a lot of patients is why the price differs. You may go to one place where a unit of a particular one, say Botox, might run $10 to $12, whereas if you go for Dysport, one unit may run $6 to $8. So the big difference, again, is a lot of times just the units and the way they're packaged, right? So let's take, for instance, Botox or botulinum toxin. One vial typically comes with 100 units, and you compare that to Dysport. One vial of Dysport comes in 300 units, right? So don't be thrown off by it. The way I use it in my practice is they're pretty much equivalent to each other, meaning the 300 units of Dysport, I use it very similarly to 100 units of regular Botox, right? You see with a lot of patients, especially patients who have been on these neuromodulators or a particular variation of it for extended periods of time, sometimes you'll get kind of toxin fatigue where it doesn't last as long as it used to. You don't get the same results like you used to. And why? It's because sometimes our body develops tolerance to it and you metabolize it faster, right? A lot of times we'll have patients who will come in and say, wow, I just metabolized this one so quickly, so I use this one. That's a specific incident where I'd switch from one to another to just kind of break up that routine and see how the patient reacts. Again, when I use them equivalently, whether it's 100 units or 300 units, but when I actually dissolve it in the same volume and use it in the same way, I typically get very good results and pretty consistent results all across the board. If you're allergic to one particular one, that's something where you should speak with your actual kind of medical provider, whoever's doing the procedure, because again, they are variants they're almost like cousins of each other. So you may have similar reactions despite switching from one brand to another.
Does Botox last longer than Dysport?
Does Botox last longer than Dysport? It's hard to say. I think, again, it just depends on how quickly the patient metabolizes one or the other. For some patients, Botox can go a very, very long time. For others, it doesn't. And you could probably say the same thing about Dysport. Thank you for watching. And if you're interested in getting some Botox, come on by to RJ Clinical.